For more on this potential marijuana policy change, I want to bring in tonight Kevin Sabet. He's a former advisor to the Bush, Clinton, and Obama administrations on drug policy and the president and CEO of Smart Approaches to Marijuana, a nonprofit working to educate the public on marijuana use. Kevin, thanks for joining Top Story tonight. Let's get right to it. You do not think this is a good idea. Why?
No, it's not. Listen, while it wouldn't legalize marijuana, which I think would be even worse idea, this isn't a good idea because it's going to supersize the marijuana industry. It's going to turn them into big tobacco, which, we all know how that movie ended. It's going to give them tax breaks, so they'll be able to commercialize and promote their products. And their products today are super strength, highly potent THC edibles, the cookies, the candies, the concentrates that can be up to 99% potent, genetically bred marijuana. So I don't think this is a good idea for public health. It also reeks of electoral politics.
Well, I'm going to ask you about that in a second, but in Blaine's report, which we just saw there, she reports that in the last 20 years, the public sort of sentiment on marijuana has shifted in America, going from 34% of Americans who believe marijuana should be legal to now 70%, and you have nearly half the states who have legalized it. Isn't this sort of the momentum where marijuana is going in America?
Well, there's no doubt the industry's done a great job at tricking people into believing something that the science says is completely the opposite. When you look at what marijuana is doing for psychosis, for example, schizophrenia, increasing it by 5 times the likelihood, according to the Lancet Medical Journal, the most prominent one in the world. When you look at IQ loss, 8 points. When you look at testosterone issues with reproductive issues, cardiovascular, heart, lung. I mean, smoking anything is not good for you. Inhaling something with hundreds of hydrocarbons and carcinogens is just not a good idea. You would have thought we would have learned our lesson with tobacco, but it seems like we need to learn again.
But along those lines, I mean, should alcohol also be illegal?
Well, I mean, alcohol, is not legal because it's good for you, right, Tom? Alcohol is legal because it's been around Western civilization, used by 80% of Western civilization for the last 5,000 years. That's why it's legal. And by the way, we have considerable damage from alcohol. Don't get me wrong. I mean, alcohol is the #1 drug of abuse for violence and even incarceration. But, if your headlights are broken, you don't try and break your taillights just to be consistent. We should learn from the alcohol example and not normalize and commercialize today's highly potent marijuana.
And you believe marijuana is a gateway drug, right? And not only is it bad by itself, but it could also lead to other bad choices?
Well, it can. I mean, we see that people, if you use marijuana, you're much more likely to use other drugs. But obviously, if you've, use marijuana, it doesn't mean you're definitely going to use other drugs. But again, if you look at people who use cocaine, methamphetamine, heroin, fentanyl, 98% of them started with alcohol and marijuana, the 2 most widely accepted and available drugs. So yeah, it's also not a good idea on that. But I think on its own, this is a different drug than it used to be. It's not Woodstock weed. I don't think you should go to prison. I don't think you should go to jail. Don't get me wrong. I don't think you should be criminalized. But why do we need to go to the other extreme and commercialize it?
So that's my next question. Why do you think President Biden wants to do this?
Unfortunately, I think it's electoral politics. I mean, I think President Biden knows that this isn't good, actually. I think deep down he knows that. I mean, he frankly is the founder of the Office of Drug Policy that established the drug czar. I mean, he's the reason we have that. So back in the early 80s, against Ronald Reagan's wishes, believe it or not, he wanted a drug czar. So I think he probably sees this as somewhat of a compromise, maybe between legalization and sort of doing nothing. And I think this is really driven by a lot of his advisors who think this is going to get young people out to vote. But, the recent IOP Harvard poll that you all have referred to many times, that many people are talking about, surveying young people's attitudes, marijuana doesn't even register in terms of a top 15 reason why they would even get out to vote. So I actually think this is even wrong on the politics.
Yeah. I do want to ask you, though, you mentioned about alcohol being around for so long. I mean, marijuana has been around for so long, right?
Oh, yeah.
And you have so many crimes. You have DEA agents who spend countless hours stopping marijuana smugglers as well. It's clearly in the country. It's being grown. It's legalized. Wouldn't it be better to sort of make laws, cater laws that could get it maybe under control and help the country in some way? Or do you see that as just completely impossible?
We've tried that I think it's impossible, Tom. We've tried that for over 10 years in Colorado and California. What's happened? We have an underground black market bigger than before legalization, because when you increase the demand, you increase the ability, you increase the ability for the black market and black market actors. We have Chinese national smugglers connected to the Chinese Communist Party that are now part of the marijuana industry in this country, growing it in legal states. So, I don't think that is the answer. I'm not saying we should be arresting people, throwing them in prison. By the way, this new scheduling decision does nothing to get anybody out of prison. It won't stop arrests for marijuana. I mean, that's sort of the cynical part about this that I'm looking at it, is that it's touted as social justice, but in reality, the people hurt the most are going to be the people with the least number of resources, just like alcohol and tobacco, and I worry about that.
Kevin, what is your solution to try to get, I mean, at least the drug enforcement and the issues of marijuana under control?
Well, look, first, let's do some more research. We need to see what this super strength marijuana is even doing in the long term. We know in the short term it's causing psychosis, things like that. What is it doing in the long term? I don't think we should be arresting, throwing people in prison. Thankfully, we're not doing that. So that's already not happening. I think we need, frankly, Tom, a lot of education, a lot of awareness. In a credible way, not in a scary way, not in a sort of over dramatic way, but in a credible way about what the science is saying. And frankly, when I talk to young people, even if they don't want to believe the science, I just tell them, listen,
I mean, when you say, Kevin, when you say educate, I'm just trying to understand, and I don't mean to be flip here, but I mean, people know they're going to smoke weed, they're going to eat an edible to get high. I mean, what more education do you want to give them?
I don't know if you read Maureen Dowd's column when Colorado legalized marijuana. She had an entire edible and ended up, she thought she was going to die that night. She didn't know that was going to happen. I don't think most Americans realize that it increases psychotic episodes by fivefold, that it increases suicidality, that it's the #1 drug among youth suicide, people who die by suicide, who are young people in Colorado and other legal states. I don't think they realize it doubles your risk of a car crash because you've lost depth perception. I don't think they realize that it's causing cardiovascular incidents. Major study, thousands of people just released by JAMA a few months ago on that. I just don't. I think the industry's done a great job. And again, you mentioned alcohol. I want to go back to that because I'm not trying to sidestep that.
Yeah.
It's true. Marijuana has been used for thousands of years in different cultures, never to the extent of alcohol. You can't compare. It hasn't been 70% of Western civilization. So I think that is a huge part of this.
But also historically, it's an unfair comparison because, I mean, like, there were times in the Middle Ages when it was safer to drink beer than it was to drink water because the water was contaminated,
sure.
It is not a fair comparison, but alcohol destroys lives. Alcohol has led to countless deaths and injuries, and the advertisements. I mean, that's a whole, we could have a whole show about that.
Part of the reason that's the case, Tom, is because it's been legal and commercialized by a for-profit industry. It's not just the alcohol. It's tobacco, same thing. We used tobacco for thousands of years and people weren't dying of lung cancer until we had big tobacco.
I get it. But would you also argue then less regulation is better? I mean, I just want to be clear on your point.
No, listen, where it's been legal, I want to see, listen, I'm all for the regulation where it's been legal. I mean, where it's been legalized, like Colorado, let's get potency caps. We don't need 99% potency. Let's at least do 20%. Let's get rid of child-friendly products. Let's get warning labels. What's happening to pregnant women out there with marijuana is huge. I think we're really underestimating the current damage of marijuana because it's seen still by most people as no big deal.
Right.
And the reality is it's a different drug today. Yeah. And so I don't have my head in the sand, but listen, this industry wants to do nothing of the sort. They won't let warning labels pass. They won't let any of that stuff pass because it hurts their bottom line. This is about profit, Tom. It's about profit over public health. It's about dollars and cents, unfortunately.
Kevin Sabet, I'm so happy we had you on Top Story and we had your perspective tonight. Thank you for being here.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.